name is Aleidy and I live in Midtown in New York City. I came to this country when I was 8 years old with my mother and my sisters. When we came, we didn't have much money. My mom didn't have a job. My dad was working as an electrician, but he was gonna be the only one working, supporting 4 people, 5 of us. And we started going to the clinic a couple of weeks after we came to the country because we needed the physicals to get into school here. So that's how it all began.
So when Aleidy started to receive her medical care here as a child, she received it from Dr. Tolentino, who's from the Dominican Republic. So this is a doctor who spoke Aleidy's language and was also could also understand her culture.
I remember we were 3 little girls, and when they asked our names, which are very funny because it's myself, Aleidy, then Gladdy Lady, then Lady, and they called us, oh, here are the ladies, the 3 ladies. So I remember everything, and they made us feel so welcome.
Her mother was ecstatic to find, a doctor that spoke Spanish, but also a doctor that came from the Dominican Republic.
When we came in, they told us they would treat us regardless, and they had special programs to help people that didn't have the money.
And for me, that was my goal in going to medical school, was to service my community, to be there for them as a physician, but also to understand the cultural differences.
A year later, I started getting heart palpitations. It's funny, I went on a trip to the Bronx Zoo, and we went to the butterfly house. And on our train ride back home, I felt a weird fluttering sensation. And I told my teacher, I think I swallowed a butterfly. I feel it in my chest. And I kept on telling her, I know I swallowed. And I came home, Mom, I swallowed a butterfly. It's in my chest. And they took me to the doctor, and it was just the symptoms from the arrhythmia, that's what it's called. The cardiac arrhythmia was because this weird fluttering sensation that I could only describe it as a butterfly in my chest. I actually had to wear a monitor throughout high school, a heart monitor. So I remember it was funny because, in high school you want to look good, and you're very self-conscious. So they went through all these companies to find one that was really small, so people couldn't really tell I was wearing it.
Aleidy transitioned into receiving adolescent care here and into her adult care, and also received prenatal care here for both her children as well.
I am the mother of 2 children. They are ages 6 and 4, Haley and Jake.
I've been taking care of Haley and Jake since birth, and they're 2 healthy children, but they come in every year for their physicals, and if something comes up in between, if there's some health concern, Aleidy either bring them in. Even though they're healthy children, it's still important for them to get a physical every year and make sure that everything is okay with their general health, their vision, their hearing, their development.
She still prefers to commute to our clinic because she feels the care here is better and that we actually provide the services that her children need.
Who's that?
Who's this, JT?
This is me in your stomach. Mama?
Aleidy moved from this area a few years ago with her family. She is doing extremely well. She's going to college, pursuing nursing. Her husband also went to college. So they moved to another part of the city, but Aleidy still continues to bring her children here for care.
And I think that it's always coming home when you have a doctor that understands what you're saying.
I took Haley to a doctor nearby, a pediatrician, and she said, the minute we walked out of the clinic, she was, Mom, I want my Dr. Machuca. I want her back.
And for me, it really motivates me to continue to do the work that I do in this community every day.
You see the love they put in what they're doing. There's so much love. It's remarkable. They don't need to do that. They don't have to, but they do it anyway. They make you feel at home.